So the Diagnostic and Statistical Manual, or the DSM, has a 5-axis system which we use when we complete a diagnosis. Anytime we complete a diagnosis, we can include all 5 axes of this diagnosis. This provides us a snapshot of the big picture of this individual, instead of just one simple diagnosis. Because even someone with depression is much more than a person with depression. There's many more factors that could be coming into play that we need to consider, even as psychiatrists, psychologists, counselors, whatever we are. So what are those 5 axes? Well, Axis 1 and Axis 2 look at the psychological conditions in this individual. Let's start with Axis 2. It's the simpler of the two. It has 2 major types of conditions. One is mental retardation, or anything else related to intelligence. And the other has the terms personality disorders in the name. It has to have those 2 terms. Doesn't matter if it's a personality trait or if you think it's a personality trait. If it doesn't have the words personality disorder, it does not go there. So for example, borderline personality disorder, avoidant personality disorder, histrionic personality disorder. All of those have those 2 words in the name. They would go on Axis 2. The other psychological disorders go on Axis 1. So major depressive disorder, bipolar disorder, schizophrenia, autism, anything else that doesn't have mental retardation or personality disorder in the name goes on Axis 1. Axis 3 looks at things from a medical standpoint. So it's any kind of general medical condition. So you broke your leg, you have a heart condition, you have diabetes, anything like that. This is important for a couple reasons. One is sometimes medical conditions can cause psychiatric symptoms. So someone with hypothyroidism can have symptoms of depression. We can treat the hypothyroidism and then indirectly treat the depression as well. The other factor that we need to consider is medication. So someone who has depression may also have a heart condition. They may be on a MAOI for their heart condition, for their depression, and that can influence their heart condition. So we want to pay attention to what those 2 medications are and how they might affect each other. On Axis 4, we are looking at psychosocial stressors. So basically any kind of stress that's going on in their life that could be influencing things. We know that from the diathesis stress model that stress plays a big part in the influence in the cause or the etiology of many types of mental illness. So we want to pay attention to what some of those stressors are. If someone's depressed because they're in a bad relationship, it doesn't matter how much medication we give them. If we're not dealing with the stressors of that bad relationship, they're not going to get over that depression. And finally, Axis 5 is the Global Assessment of Functioning, often abbreviated with the letters GAF. This is a 0 to 100 scale that assesses where that individual is functioning at that moment in time. If they're at 100, they're perfectly fine. If they're at 0, they're probably in a very, very, very severe state, if not dead. And we can break it down little by little. If we see someone with an 80 to 100, they're actually doing pretty well. 60 to 80, they're having mild impairments. 40 to 60 moderate, 20 to 40 severe, and less than 20 they're probably either severely suicidal or severely threatening someone else and homicidal. And there's more specific details in that that you can find as well. So when you're completing the 5 axes again, you can include all 5 axes. If you don't have anything to put on one, you just write the word none, but all 5 need to be there to provide a good snapshot of that individual.